Okay, it's recording.
Okay. Hello, my name is Karen Davis. I'm here to talk to you guys about how to become a nurse. And today, I will talk about the history of nursing, some of the different levels of nursing, nursing professions, and educational path that's required as a career in nursing. The duties and the certificates that is required for nursing. Okay. Imagine this is flu season. Imagine coming in full of people, sick people in a clinic or a hospital. They're needing your help for vaccination, examination, and prescribed medication. With your help, they're needing to be listened to, educated, and with skills like this, they will provide the best care to support the doctors. In order to become a nurse, you will need to be caring, sympathetic, long life learning individual, detail-oriented, a good listener, and committed to a long life of just learning a lot of different things about the patient. The word nurse came from a Latin word nutri, which means nourish. In the 16th century, it became known as the modern meaning of a person who cares for the infirm. Florence Nightingale founded a school for nursing at St. Thomas Hospital in London that became the model for the United States nursing education. Formal education programs for U.S. nurses were established in 1873. The organizing for nurses were the periods between 1893 and 1908. Formation of the National League for Nursing, founded in 1893 as the American Nursing Organization in the United States. Today, the National League Nursing offers professional development, networking opportunity, testing services, nursing research, grants, public policy initiative to about 40,000 individuals and about 2,000 institutional members. What is required as far as education to become a nurse? I would speak of 3 degrees or diplomas that there's plenty more, but I will speak of 3. The first is a diploma, LPN. This diploma takes 1 year or about 18 months of schooling. You can attend a vocational school or a 2-year college. LPNs were originally educated and trained to work as bedside nurses in hospitals and today in a wider range of duties. They worked in nursing homes, rehabilitation centers, physician's office, schools, clinics, dialysis, wound, hospice, and home care agencies, psychiatric centers, and much more. In many states, LPN are licensed to administer medication, care for a patient who is ventilator dependent, and even start intravenous fluids, IV. Okay. Associate's degree for nursing, which is an ASN or AND. This degree takes 2 years at a university, community college, vocational school, or even at some hospitals. The training program allows nurses to deliver direct patient treatment carry out other qualified nursing duties and responsible inside the field of healthcare, such as observe patients and report on their well-being, like a chart. Keep a thorough record of patients, medical history and symptoms, perform diagnostic tests on a patient sample, and analyze the results. They operate medical equipment, administer medicine and treatments to patients, come up with treatment plans for patients, care and teach patients how to manage their illness or injuries at home. This is a groundwork to further educate. This is a groundwork for further education for a bachelor's and a master's degree. Bachelor's degree, BSN, is more traditional degree. It takes 4 years acquired from the time of entry as a freshman to graduation. At most of the university and colleges that offer these programs, pretty much, like, say for instance, if you have an associate in liberal arts, you probably just have to go 2 more years. And you will have to, again, go to a 4-year college for that. The BSN performed in most medical environments, while the job, RN and BSN degrees may be almost identical of that of RNs with an ASN or an AND degree. Those who complete the BSN program have additional preparation, training, for clinical jobs that could include management, physical duties, medical personnel scheduling, and administration. Leadership, research roles, they can advance their career as getting accepted into a master's nursing program. All programs of nurses allow students to specialize in certain areas of medicine nursing and gain better pay. Nursing care facilities for treating elderly patients, which can include long-term rehabilitation and care for patients that were recently discharged. What is a nursing salary? Salary can vary depending on your location and the number of years you have worked, the type of facility you work in, and your health care. With diploma, they pretty much start at $46,000. The associate's degree, RNs, $54,000. Bachelor's degree, $61,000. What you need to have at the end of the program is the annual CT certification. Actually, you need to have that before you enter into the program. Annual preventative disease transmission certification to prevent infectious disease like needle sticks or sexual transmitted diseases. There's another exam. There's an exam that you have to take called the NCLEX exam. That's a standard exam from the state. Like you take a state board test, and it determines whether or not a candidate is prepared for the entry level. Okay. Lastly, what we pretty much discussed was the history of nursing, the educational path and the duties of nurse, the specialization and the benefits of being a nurse. Nurses is a career in high demand and requiring special education training. And I just want to thank y'all for taking the time out and listening and getting information on how to become a nurse, and I appreciate you guys. Thank you. You was good until the end.
That's hard to do, isn't it?
I know, and I know you wanted to. I know.
It's all right.
I'll see how it goes.
It's hard to do. I mean, it's very,
It's very hard for everyone.
it's not for everybody.